What are passive movements? These are movements carried out by another person without any assistance from the client. The client remains relaxed throughout, which allows for passive movement of their limbs in order to maintain joint mobility and muscle flexibility. What is high tone? This is an abnormal increase of tension in the muscles. This can make it more difficult to move the limbs, and as a result, clients could experience muscle stiffness and a reduced range of movement. How does passive movements benefit a learning disability client who has high tone? Movements help change the pressure in the abdominal cavity, which helps with bowel movement to relieve constipation. It relieves pressure on internal organs of breathing and digestion by maintaining spine symmetry. It improves muscle tightness, increases blood circulation, increases the heart's aerobic capacity, decreases joint stiffness, reduces joint pain, and it helps in the release of endorphins for stress relief and relaxation. Things to consider before using passive movements on your client. Get consent from the client before proceeding with these techniques. Otherwise, continue in the best interest of the client with guidance from the multidisciplinary team involved in their care. Refer to the Mental Capacity Act 2005. Seek advice from a health professional, such as a physiotherapist, before proceeding with these techniques to ensure it is suitable for the client. If the client is PEG-fed, please follow their prescribed regimen on when they can be moved in order to prevent any complications. If the client experiences any adverse reactions or serious injury during these techniques, please stop immediately and seek medical attention. Passive movements should not be done on the client if they have these conditions: acute injury, early and stable fracture, intolerable pain, incomplete muscle or ligament tear, compromised circulation, shoulder subluxation, and osteoporosis. When and how often should passive movements be done? These exercises can be done for 15 to 30 minutes per day at the same time each day. Tips: ensure client is in a safe and comfortable position and adjust bed to suitable height for your comfort. Due to the increased sensitivity and high tone, do be firm in your handholds and avoid doing the movements too quickly to help the limb relax.
Hey guys, so the first movement we're going to be doing is opening and closing of the hand. So if you have your supporting hand around their wrist and then your other hand just on the back of their hand, and pull the fingers out up towards the sky, opening the hand up, and then bend it back down into a closed fist position. If you make sure that their elbow is bent around 90 degrees, just so that they're most comfortable in that position as well. So in this video I'm going to be doing all the movements 15 times to give you time to be able to do it alongside me if you're going to copy me in this video. This is just showing that same opening and closing of the hand from a different angle. Next we've got wrist flexion and extension, so moving it forwards and backwards. Again, they're lying on their back with their elbow flexed to about 90 degrees, and your supporting hand is going to be around their wrist and your other hand just gripping around their palm. So you've got to grip quite firmly, but try to keep your fingers straight so that you don't dig into their skin at any point. And this here is just to show it from a different angle again. So the same movement, just forwards and backwards of their wrist. Now we have moving the wrist from side to side, so almost like a waving motion. So your supporting hand is around their wrist still, and then your other hand is still gripped around their palm in the same position as you were before. And now you're just tilting the wrist from one side to the other, so from side to side, as if they're waving. Just a few more left for this one. And now we're going to be bending and straightening the elbow. So your supporting hand is going underneath the back of their arm, just above their elbow on their triceps. And then your other hand is just supporting them around their wrist. And you're moving the wrist up towards the shoulder and then back down again. And again, they're lying down comfortably on the bed during this. So now you've done this one 15 times. I'm just going to show you what it's like if you've got a client who's already got high tone, so if their wrist is already flexed up towards their shoulder. So in this one, if you just pull down from that flexed position with your hands in the same positioning on the wrist and underneath the back of the arm, and if you just pull down towards yourself 15 times this way instead. So you don't have to be able to get the full range of movement and be able to get a straight arm, but just any movement is good in these passive movements to get the joints moving again. So we're just going to look at some shoulder flexion now. So bringing their arm up to over the top of their head. If you have one hand again underneath the back of their arm and the other one just supporting around their wrist again. And if you just move their shoulder from down by their side just to over their head as far as they can go. And just moved it comfortably through that range. So we've got another 5, 4, 3, 2, and just one more of these ones. So now on to shoulder abduction, so pulling the shoulder out to the side with a straight arm like this. So you've got one hand supporting just above the elbow joint and the other one's alongside the wrist. So again, you're just pulling the arm out towards your body. If you stand above the arm, it means that you don't have to bend over so much, so it's okay for your back. Just a few more of these ones, just pulling out to the side like this. Again, now we'll just show how to do the same movement at the shoulder, but just if your client's elbow is still flexed due to high tone. So it's important to still move all the other surrounding joints, even if they are stuck with a bit of high tone in the elbow. So perform the same movement as it was before, but just with the elbow bent up, just like this, to keep the movement around the shoulder as well. Moving on now to some rotation around the shoulder. So you've got one hand supporting underneath the back of their arm and the other hand surrounding their wrist. So if you just pull the wrist in the inside of your arm, down towards the ground, and then back upwards towards the client's head, just like this. And repeat this one 15 times as well. With all of these movements, it's important to try and keep your hands in the same place. So once you've got a handhold, try and keep that one for the whole of the movement, just because the more you move your hands, the more you're stimulating the skin, which could cause more increased tone in their arms. This next one is to show how you do the same shoulder rotation, but just if they've got high tone in their arm. So if their arm doesn't move too far away from their body like it was showing in the other one, you can still do the same movement, but just hold their arm close to their body instead. So support under the back of their arm still, and your other hand on the wrist, and then rotate the shoulder so that the wrist goes in towards their stomach and then out towards the floor. And repeat this one 15 times instead. Now I'll demonstrate a throwing task. So if you just open up their fingers and support under the elbow, as you reach forward, grab onto the ball, pull back, and then help with the fingers to release the ball at the end. You can also practice this one, so by opening up the fingers in order to put a jacket on, feed the fingers through, keep supporting the hand as you're doing so, pull the sleeve on, arm out to the side just to get more of a movement in that shoulder, pull the sleeve down and support the elbow and wrist back down to their lap. So now we're on to the lower limb of the passive movements. So you've got one hand just supporting on the shin and the other one supporting the foot just underneath the heel. Then you're using your forearm, using the foot against your forearm just to push it up towards the direction of their head, and then let it come back down again into the natural position and flex it back up again towards their head. And repeat this one 15 times as well. So next we'll be looking at the foot. If you use both of your hands and put both thumbs on top of their feet and then all 4 fingers underneath the base of their foot, and push one hand up and the other one down, and then alternate between them to get some movements between the joints in the toes. Next we're looking at knee flexion, so bending and straightening the knee again. You've got one hand supporting underneath the knee joint, and then another one holding the foot underneath the heel again. With this one, if you try to sway with your legs so that your back isn't twisting, and then pull the foot up to the back of the thigh and straighten it back out again, and repeat this one as well. Now moving on to bending and straightening the hip, if you slide your hand slightly up the back of their leg and then use his hand positioning instead, so the other hand is still supporting underneath the heel, but if you move the hand which was supporting underneath the knee just slightly further up the leg, and then just using both hands to bend the knee and pull it up towards the direction of their chest, getting lots of nice bending happening at their hip, and then straightening it back down towards the bed. Just a few more repetitions of this one, and then we'll go on to a different movement. Now I'll be moving the leg out towards the side, so one hand supporting over the top on the inside of the thigh, just underneath the knee joint, and then the other hand still underneath the heel of the foot. And if you lunge back and pull the leg out towards you, it stops you bending over and injuring your back. This next one's a demonstration for if you've got a client who has high tone in their legs. So if their knee is quite flexed naturally and you can't get that straight leg, you can still do this abduction at the hip, but you just do it with the leg flexed up like this. So you can still get all the movement there, but it's just in a different position. So if you support on the top of the knee and then underneath the heel of the foot, and almost roll the hip out towards you and then push it back into the middle. Next we're on to rotation at the hip. So if you support on top of the knee whilst the hip is flexed to 90 degrees, and then your other hand supporting under the foot, and if you pull the foot towards you, keeping the knee steady, and do this one 15 times, and bring it back to the midline, out to you and back. This one is the last of the passive movements of the lower limb. So now I'll just go on to show you some more functional movements again. First one is this example of kicking a ball. So if you support under the heel and the toes, extend the leg forward and bring it back to a comfortable position. And we've also got this example of bending at the hip and knee onto a raised surface to help with putting on socks and shoes. So if you put the sock on like so, and then bend at the hip and support under the foot to a comfortable position again.